Hi, everyone. I'm Jody Schwan at Sioux Falls Business. Thanks so much for joining us for another in our continuing video series. I'm very glad today to be able to catch up with Dr. Mike Elliott. He is the Chief Medical Officer at Avera McKennan. Obviously been an incredibly busy set of weeks, even months now for him. And there's a lot to discuss today. If you are just tuning into the news, or maybe you've been following us already today, we've got some changes to talk about as far as what the city of Sioux Falls is proposing in terms of easing up on some of its mitigation strategies. Of course, that follows an announcement earlier this week from the state that allowed many of the municipalities to begin to consider recommendations and measures like this. So I am anxious to get the bird's eye perspective, up close view of all of this from Dr. Elliott. Doctor, thanks so much for being with me. Why don't you tell me how things sit within Avera McKennan today? Give me a sense of the volume you're seeing as far as the COVID-19 patients are concerned, and maybe how that compares to whatever your expectations might have been for this point in time as we prepare to wrap up April and head into May.
Sure. Thanks, Jody. Thanks for talking with me today. We have done a lot. Avera McKennan, Avera as a health system, like many other health systems across the country, to prepare for an impending surge. We held anything that we considered to be an elective surgery. We've gone to virtual visits. We've done so much to try to make sure we have capacity, bed capacity, ventilator capacity, gowns, masks, gloves to keep our staff safe and protected during the surge. So as of right now, we are sitting very well. We do have ICU beds, ventilators available. We have an abundance of medical surgical beds available. We have staff, our regular staff, as well as staff we have deployed from other areas of our organization. So we're sitting very, very well. When we first heard about the possible surge, they were saying we were going to be in the midst of a big uptick right now, maybe seeing double to triple what we're currently seeing, and those numbers were going to rise very fast. We have not seen that yet, although we sit ready for it.
Why do you think that is?
Oh, I think it's a whole host of things, Jody. Predictive modeling is only as good as the data you have. There were no upper Midwest cities that had seen a surge when folks started to build the models. We had to base it off of what was reported from China, what they were seeing in Italy and Spain, and even New York as the pandemic got closer to us. But what we're seeing is we seem, at least at this point in time, to not be following the same numbers as some of those other places saw.
Does our population density likely figure into that, do you think?
I think our population density certainly plays a factor in it. Maybe our attempts at social distancing have played an effect. The fact that we've had some time to prepare for this, for people to limit their risks, undoubtedly has flattened the curve for us and made a difference.
Are you seeing any, I'll call it trending, for lack of a better word, but among those patients who are coming to you who ultimately do require hospitalization?
Right now in Sioux Falls, a majority of the hospitalizations have been relatively younger people. We've heard all along that it is folks over 65 and those with significant comorbid conditions that are more at risk for severe complications of COVID and more likely to be in the hospital later or in the intensive care unit. Right now in Sioux Falls, we haven't quite seen that yet.
And I suspect perhaps our older population really has been staying home as word of this has gotten out. Obviously, the governor's executive order essentially required people who are senior citizens to do that. what would your guidance to them be as far as when they might or should think about venturing out? I mean, should they continue to stay home? Is there going to come a point where if you're in your 60s, your 70s, your 80s, and you really just want to grocery shop for yourself, that you'd be able to do that?
Yeah, that's a good question, Jody. You know, all of these models, all of these curves we've looked at and talk about flattening the curve, we never intended to tell anybody that we were going to stop the pandemic. It is going to happen. We're hoping to just be able to slow it down so that our healthcare systems don't get overwhelmed. The same things, and I know they sound somewhat basic, but the same things we heard from the Center for Disease Control a month ago, 2 months ago, are still in effect and still very good strategies today. I've said all along, what we should try to do is limit our risks. We can't eliminate our risks, but if we can limit them, if we can make sure we're washing our hands good, if we can try so hard not to touch our faces, if we can avoid going to places where there are large numbers of people, if we have any symptoms at all, assume that you're contagious and stay home. Wear masks when you can. All those things are intended, again, to limit the risk, but we know there isn't anything we can do that's going to eliminate the risk. That we're going to have to wait for vaccines before we really start to have talks about how do we reduce the number of people that are going to be infected.
I want to have you elaborate, if you can, a little bit on the masks, because while I've started to see a number of them out and about, I've seen resistance. We've had readers who don't like this idea that they are being, I'll say, strongly encouraged, maybe in some cases required, to wear a mask. And I do still go into a number of places where a sizable percentage of people are not wearing them. Why should you wear a mask?
Sure. That's a great question. And I'll tell you, research will say that wearing a mask can be good or bad. I'll tell you, if you're constantly fidgeting with your mask, constantly touching it, and then rubbing your eyes or itching your nose, you're not doing yourself any favors. But we have heard all along that COVID is contagious even before it's symptomatic. So what that means is you could be shedding the virus even before you have any symptoms. And so by putting a mask on, you're protecting other people if you yourself are shedding the virus. If you're wearing a mask because you think it's going to protect you from other people, that's probably not the case. Research is not showing that if Jody, if you or I wear a mask, that we're going to be protecting ourselves. It's really you and I doing our part to protect other people. If we have the virus, if we're shedding it, we can reduce how much we shed the virus to other people. It's us looking out for other people. That's why wearing a mask is helpful and is important.
I do think that's helpful. Any other guidance, maybe in particular for parents? You know, some of the restrictions within the city are lifted even today. You're going to have access to our park system, for instance, and our playgrounds that you would not have had here in the last few weeks. You're going to have ability to interact maybe in those places with other people. What should we be keeping in mind as a community, and particularly as parents, as we do start to see more of those interactions potentially occurring?
Yeah, another good question, Jody. Thank you. Some of the same things still apply, and I apologize if I'm going to sound like a broken record, but keeping gatherings to 10 people or less, maintaining 6 feet of separation when possible. Those suggestions are still real. They're still practical, and they still help limit your risk.
Okay.
If you were to go to a playground and you see that it's got 50 kids running around on it, maybe you think twice. Maybe you go, well, maybe today is not the day, or maybe that's not the park that I want to take my kids to. You go to a park and there's very few people there and it's a beautiful sunshiny day, then maybe you say, okay, I can wash my hands. I can talk to my children about not touching their face, and we can enjoy the outside a little bit, and we can try not to get back to normal, but we can try to figure out how are we going to live with COVID going forward. I think it's so important that I don't know that we're going to get back to normal. I think we're going to have a new normal. And for all of us to be safe, we've got to figure out how to live with COVID.
Right, exactly. I want to talk a little more about your modeling. I know you guys have been on top of that as best you can all along here, and the mayor shared today that now we're looking at a mid to late May peak that compares to an early to mid-May peak, even as recently, I think, as a couple weeks ago. Does that take into account this idea that we potentially are going to be easing restrictions a week from today, allowing some more interactions to occur?
You know, Jody, I'm a little hesitant to answer that. I'm not sure I know exactly what's going into the model that the governor is using or that the mayor is using. My perception is most of the modeling we have right now still assumes that there's some impact of social distancing, some impact of the folks over 65 and those with chronic medical conditions still trying to do some isolation. But I don't know with 100% certainty what factors went into their model.
You guys, I guess internally then, I'll just get back to that because you've looked at lots of scenarios. We've talked with you about your surge planning, how you plan to find those extra beds, where you might even end up locating them. Do you feel like you're going to have to bring any of those contingencies into play here in the next few weeks? Or do you feel like it'll be somewhat business as usual, even if more of the patients taking up those beds are COVID patients?
At this point in time, we stand very ready to take on a large surge. I don't know exactly when we're going to ratchet that back. I think we'll know more in the next couple of weeks. But right now, we've done a tremendous amount of planning to be, as you said, very, very ready for this. And even though we're talking about restarting some types of surgeries that we have delayed, maybe restarting some clinics that we have maybe delayed some routine visits for, or tried to shift things more to virtual visits, we still stand very much at the ready to take on a surge if and when it comes.
I'm hoping maybe you can help me understand a little bit about as far as where we're at with testing. The state has said statewide we have the capacity now to be doing 3,000 tests a day. We're not seeing anywhere close to that in terms of results coming in day to day. Are we just not seeing as many people presenting with symptoms, or where would you say we're at as far as who we're testing, why, and how that might change going forward?
Okay. So initially, there was very much a limitation in our ability to test. And so we had to decide who were the most important types of people to test. And that was people that were in the hospital. And we needed to know real quickly whether they were COVID positive or negative so that we could determine whether they needed to be in a negative isolation room and what type of personal protective equipment our staff needed to be using to safely care for them. As we have gained the ability to do more tests, we have expanded our testing to folks such as nursing home residents and others that maybe weren't on the top of our tier in the beginning, but now that we have the expanded ability, we will be able to test more, and we'll look at who should those people be. One question we're asking right now is, should we test everyone that comes into the hospital before they have surgery so that we know what type of personal protective equipment our operating folks need to have? I don't have an answer for you at this time, but I do know that there are a lot of people looking at that and other questions to say, who should we test given our current capacity to do that?
Have the tests themselves evolved somewhat? I know when they first started, they were one, quite invasive, and two, took a while to process to get the results.
Sure. So most of the tests now still require that swab to be placed in your nose and the back of your throat. And that's not a comfortable test. It just isn't. But that still is the main way that the sample is collected for these tests. Yes, the tests have evolved. We can turn the results around faster. When we first started, a week turnaround time was was not surprising, particularly given the fact that you may have to send the sample to a distant location in order for it to be run. Now that we're able to do them more in-house, shorter travel distances, we're getting to the point now, at least here in Sioux Falls and in most of the state, where we're expecting a 24 to 48 hour turnaround time. Now, from the folks I've talked to, that's not the case all around the country. Some places still have that week-long wait, but we're fortunate here in this part of the country.
Got it. Any thoughts on antibody testing and when that might become a little more broadly accessible around here?
Lots of conversations around antibody testing, Jody. I don't know that I have anything real definitive to tell you today, other than we're going to have, I suspect, within the next couple of weeks, the ability to do it. But exactly who should be tested and how we should do that, and even what it means when we get a result back, are questions we still have. One of the challenges right now is there are different antibody tests out there. Some are much more validated. And of course, as a healthcare system, we are only going to use those tests that are absolutely validated. Some that came out real early or talking about a quicker turnaround time, the validity of those tests was not what we would need it to be to use it for a health system.
Got it. I want to shift gears a little bit and talk therapeutics. And I think one of the game-changing elements of all of this is going to be when we get a reliable way to treat people with some type of medication when they do contract this. Where are you at as far as testing things out? We announced a couple weeks ago now, I think, that Avera was part of the blood plasma study being led by Mayo Clinic. How is that going? Are there any other promising therapeutics that you're beginning to work with?
Yeah, we are looking at bringing on some additional studies. We are doing the plasma exchange and are having success in that we're able to screen folks, get them consented for that treatment, and both collecting the plasma from people that have had COVID and recovered, as well as giving that matched plasma to people that are currently in the hospital. It's, as you might imagine, too early to know if any of these things are going to pan out, but that's why we do the research. So along with the plasma study, there are a couple others that we're looking at investigating, becoming part of an investigative trial. So more to come. Unfortunately, research takes time, and you need to do it on a fair number of people in order to be confident in any results you're seeing. So more to come as we go.
Okay. And then I'll just briefly ask about your team. Obviously, there have been a ton of changes for your staff. You've got some people who are probably working as hard as they ever have. You've got some who unfortunately don't have as much they're able to do right now. And you've got others who are trying to take on new roles. How has that all been working? I know you really ramped up your training for people who are going to be maybe taking on a job that's different than they're used to.
You're right. It has been difficult. I would tell you 99.9% of people in healthcare, this is more than a career, this is a calling. And these people are 100% dedicated, Jody. I could not be more proud of the people we have here. And this is tough, because we stopped doing elective procedures, because of the changes we made to try to get ready for this surge. Our business, our volume of patients dropped dramatically. And as such, we had to make changes so that our revenue and our expenses were somewhat in alignment. And those are awful decisions that have to be made, tough decisions that have to be made And of course, we try to do that with the utmost respect for the individuals too. So a lot of sleepless nights have gone into all of those decisions, Jody. But again, I'm so overwhelmingly proud of the people that we have, the people on the front lines that put their own personal safety at risk, frankly, put their family's safety at a little bit of risk, and are doing this no matter what, because that's what we were called to do. So we're fortunate in Sioux Falls and in South Dakota to have two great healthcare systems, and with so many people dedicated to providing just top-notch care to people.
Absolutely. Well, we want to thank you for what you do. Certainly wish you all the best with whatever lies ahead here. And thank you very much for your time and for catching us up on how things are going there. We certainly will stay in touch with you and with your team. Thanks so much.
Thanks, Jody.
Again, Dr. Mike Elliott, Chief Medical Officer at Avera McKennan. It is Thursday, April 30th. I want to remind you that tomorrow, May 1st, we are kicking off the month of May and ending this week with our 605 MADE virtual market. So check back in with us on Facebook, 605 MADE and Sioux Falls Business at noon on May 1st for your chance to support our local makers, pick up some gifts, treat yourself to something. It should be a good time. Thanks as always for watching.